Hello everyone, I'm Dr. Ansuvan Matthew. I'm a registered pharmacist, and today I'm here to provide a brief information on HPV. So, what is HPV? HPV stands for Human Papilloma Virus. So, human papilloma virus belongs to the family called as Papillomaviridae. So, it is a virus. So, HPV is the most common viral infection of the reproductive tract. Most sexually active women and men will be infected at some point in their lifetime. The peak time for acquiring the infection for both women and men is shortly after becoming sexually active. There are many types of HPV and many do not cause problems. Cervical cancer is the most common HPV related disease. Nearly all cases of cervical cancer can be attributable to HPV infection. The infection with certain HPV types also causes a proportion of cancers of the anus, vulva, vagina, penis, and oropharynx. Known cancer causing types of HPV, especially the type 6 and 11, causes genital warts and respiratory papillomatosis. So, respiratory papillomatosis is a disease in which the tumor grows in the air passages leading from the nose and mouth into the lungs. Genital warts may appear as a small bump or cluster of bumps or stem like protrusions. They commonly affect the vulva in women or possibly the cervix and the penis or scrotum in men. They may also appear around the anus and in the groin. They can range in size and appearance and be large, small, flat, or cauliflower shaped and may be white or flesh tone. So, I have already mentioned that there are different types of human papilloma viruses. Some of these viruses can cause genital warts, while others can cause certain type of cancers. So, how does this human papilloma virus infection leads to cervical cancer? Although most HPV infections clear up on their own and most precancerous lesions resolve spontaneously, there is a risk for all women that HPV infection may become chronic and precancerous lesions progress to invasive cervical cancer, and it takes around 15 to 20 years for cervical cancer to develop in a woman with normal immune system, and it can take only 5 to 10 years in women with weakened immune system or those with untreated HIV infection. Talking about the global burden of cervical cancer, worldwide cervical cancer is the fourth most frequent cancer in women. So, what are the risk factors for contracting this HPV virus? It includes having a high number of intimate partners, having sexual intercourse with someone who had several intimate partners, having a weakened immune system, having areas of damaged skin, and having personal contact with warts or surfaces where HPV exposure has occurred. So, what are the symptoms of cervical cancer? Symptoms of early stage cervical cancer include irregular blood spotting or light bleeding between periods in women of reproductive age, postmenopausal spotting or bleeding, increased vaginal discharge, and sometimes it's foul smelling also. As cervical cancer advances, more severe symptoms appear. It includes persistent back, leg, or pelvic pain, weight loss, fatigue, or loss of appetite, foul smell discharge and vaginal discomfort, and swelling of leg or both lower extremities. So, what all steps we have to take, or what are the preventive measures to be taken to prevent the contraction of this virus? So, the primary prevention begins with HPV, that is the human papilloma virus vaccination for girls aged 9 to 14 years before they become sexually active. Other recommended preventive interventions for boys and girls are education about safe sexual practices, including delayed start of sexual activity, promotion and provision of condoms for those already engaged in sexual activity, warning about tobacco use, which often starts during adolescence and which is an important risk factor for cervical and other cancers, and male circumcision. So, what are the tests to detect these HPV viruses? There are tests available to evaluate this HPV or HPV related cervical cellular changes, and it includes tests like pap smear, and DNA test. A pap smear is a test that collects cells from the surface of the cervix or the vagina and will reveal any cellular abnormalities that may lead to cancer. The use of the DNA test will evaluate for the higher risk type of HPV, and it is recommended for women of 30 years or older in conjunction with a pap smear. So, talking about the HPV, human papilloma virus vaccination, there are currently 3 vaccines protecting against the human papilloma virus. WHO considers the 3 vaccines equally protective against cervical cancer. The clinical trials and the post marketing surveillance have shown that HPV vaccines are very safe and very effective in preventing infections with HPV infections. And the human papillomavirus vaccines work best if administered prior to exposure to HPV. Therefore, WHO recommends to vaccinate girls aged between 9 and 14 years when most have not started their sexual activity. The Centers for Disease Control and Prevention, that is the CDC, recommends vaccination at the age of 11 to 12 years to reduce the risk of cervical and other cancers developing in future. The vaccine is given in 2 doses, that is usually 6 to 12 months apart. People with the ages of 27 and 45 years who have had not their vaccination in the past are now eligible for vaccination with Gardasil 9. Currently, there are 3 HPV vaccines in the market. It includes Gardasil, Cervarix, and Gardasil 9. So, this is a brief information regarding human papillomaviruses and its related genital warts and cervical cancer. Thank you for listening.